something that dermatologists do other than keep us physically healthy is help us with our self-esteem in a way that, as humans, let's look at psychology, we present ourselves to the world in a certain way. And our looks have something to do with that. I'm not talking about attractiveness, I'm talking about literally the way we look is something that we identify with. And the fact that I have certain eyes or a certain nose or a certain face, this is part of what makes me me and part of what makes you you. And when we perceive ourselves as having imperfections, whether it's acne, whether it's a new scar, whether it's jaundice and this yellowing of the skin, that starts to change our self-esteem because we're seeing ourselves in a different way than we normally would. Now again, I'm not talking on an attractiveness scale, I'm talking about something that I believe is fundamental to all humans. The essence of the human experience, I believe, is connection. Oh, and I'm spilling my matcha. Nice. But I believe it's the essence of connection. And you go anywhere in the world, to any social status, to any religion, and that holds true. But how we connect with others usually has something to do with our appearance and the way we're using it. And seeing as dermatologists treat and keep healthy and either fix or change the way we look means that they play a huge role in the way that we perceive ourselves. Then if we do get into scales of attractiveness or of insecurity, if you have an insecurity, a dermatologist has the ability to either help you change something, help give you a cream for a specific condition that wasn't always there, change something about you that you've always had, like cleft palate, and this could change something you've always had and turn you into somebody who looks different. So of course dermatologists are amazing, but they're kind of an anomaly in the medical industry, because they're not just treating our health and wellness and how we physically feel, but they're also treating our image, how we perceive ourselves, and our self-esteem, kind of in a way. If you come in as a burn victim, a dermatologist will help treat that. Now, that goes more than just skin deep. Think about it. If you come in, like my personal story with cystic acne, or if you come in as a burn victim, or if you come in with a new scar, and you have walked around all of your life feeling insecure, having panic attacks in cars, hurting yourself, isolating yourself from society, never feeling good enough to speak up, to say what you need, or to get a job or an interview for one, and a dermatologist comes and fixes your skin, they have fixed the physical ailments, right? But if the emotional portion of that patient is not treated, that patient could still go around hating themselves, hurting themselves, looking down at the floor instead of making eye contact, not going in for a job interview, not going in for a job, not having confidence. So the question becomes, has that patient really been treated? And the way the medical system is set up now is that you would have two doctors. You would have the dermatologist who treats the skin, and then you would have the psychologist who treats the mental, I don't want to say mental issues, but I would say like the insecurities or some of those things that come up, those feelings, and help process through therapies such as DBT or CBT, cognitive behavioral therapy or dialectic behavioral therapy, which can really help a patient. But this person is being bounced back and forth. And seeing as the person who's treating your skin is someone that you've already opened up and trusted, my question is why dermatologists don't, or why there is not a subset of dermatologists who don't treat the patient in a full service spectrum. I wish that dermatologists, or that a subset of dermatologists, would treat both the mental and the physical symptoms. Because if I've already opened up to a doctor and trusted you, I've already spent this time emotionally investing in you, I want to feel like I'm taken care of and I want to get better. Just because something on my appearance is fixed doesn't mean I am mentally fixed. And I think that instead of bouncing from place to place, that should all be done in one. But here's why it will never happen. Doctors don't have those duality degrees. What someone is suffering with mentally and, from a psychologist's perspective is very different than screening for skin cancer or doing a skin graft on somebody. Those are two very different skills. And the truth is that one is more mechanical and one is more, galbat, like communicative. And it's very difficult because you would need to have both skills in order to do that. Legally, you would probably need dual degrees, which means more time and money, which a practicing doctor probably doesn't have. And then third, time. Do you notice how dermatologists just tend to rush us in and out? It's so frustrating because it makes me feel like I'm not cared for. And as I've gotten older and as I've gotten interested in studying medicine and understanding these things, I realized they're not trying to rush me out. They literally schedule 15 to 20 minutes with each patient. And the reason why is because that's how it works with the insurance companies, with the rest of their firm, with the rest of their medical industry. They don't have time. And if they have a bunch of patients who needs to see them, they don't have, you know, these moments to talk to somebody and ask questions other than, what are you currently taking for a prescription? Will you use this twice daily on your face? Like, for acne, like, that's all they can do. And because of the way that the medical industry in the United States is set up, at least right now, that's not going to change. And that hurts me so bad because, like, I felt that that's what I needed the most. I want to talk for a good 30 minutes to an hour about my condition, about your experience with other patients with this condition, and about what my options are. If diet is related, if allergies are related, if my stress levels are related, as opposed to just take a pill. But because of the way the insurance industry is set up, those doctors only have 15 minutes. And I used to blame the doctors because they were the front face of that. I no longer blame the doctors. I don't blame the dermatologists. I believe it is the industry at whole that has some policies and some medical law that does not allow patients to really get properly treated. Specifically, when we look at insurance, acne is considered cosmetic. It is not something that insurance covers. So if you go into a dermatologist's office and you need cancer taken out of your arm, like melanoma spots, fine, covered, right? But if I come in with disfiguring acne that is impacting how I look, how I feel, you know, it is making me suicidal, I can't go outside and talk to friends, that is impacting my quality of life. Yet it is going to take a year, 2 years worth of fighting with an insurance company to get me covered just for prescriptions, just for some doxycycline, some minocycline, and maybe some Accutane. And that to me is ridiculous, that acne is considered cosmetic. Because rhinoplasty might be considered cosmetic, a nose job, right? But if someone had a broken nose because she was in a domestic abuse relationship, then it's no longer cosmetic, it's medical. Do you see how that changes? But with acne, it's so hard to prove that. And so acne sufferers are left not only dealing with this emotional pain, the physical pain of not being able to lay down on a pillow at night, but now this financial pain as well. And something that I wish dermatologists would do would be to stand up to those medical industries, to stand up to insurance companies and say, we need more time, we need more coverage. And although there are some doctors out there that are doing that, the majority of them don't have time or they can't. And when you've got 100 patients in a day, or when you've got like 50, what are you supposed to do?